Hi, Dr. John here, and today I want to talk to you about PTSD, or post-traumatic stress disorder. I want to share with you a new, powerful, low-risk, non-surgical, simple way to help PTSD. But first, let me ask you a question. Do you or someone you love suffer from PTSD? Have you or your loved one exhausted medical treatment and now just accept jumpiness or nightmares? Or perhaps using drugs or alcohol to self-medicate has become the go-to way to treat PTSD. What if there was a way to get significant relief from PTSD? Something that helped reboot your nervous system and take those hypervigilant, jumpiness, sleep disturbance symptoms away. Something to remind your body what it's like to feel normal again. And wouldn't that be amazing? Well, there is. I can't wait to tell you about it. Many people think to get relief from PTSD with chronic meds that blunt their emotions, they need to take these meds every day or hide from society. Or they just think they've run out of options. That's what happened with my patient Susan. Susan was smoking a cigarette on her back porch in rural Alaska when a grizzly bear suddenly grabbed her by the leg and dragged her hundreds of yards into the woods. This 100-pound wiry lady was not ready to die. She fought for her life, and with God's grace, a stick just big enough just appeared as the bear was adjusting its grip. She shoved that stick so far into that bear's mouth and throat that it actually stopped. It left her bleeding and near death with a mangled leg. 5 days later, she completed her slow crawl out of those Alaskan woods, rolling in mud to hide her scent, drinking water as it collected on plants, and finding a few plants her grandma taught her that were safe to eat. Miraculously, Susan survived. However, as you can imagine, even after her hospitalization to save her leg and life, she suffered recurrent nightmares long after her recovery. I met her years later, and her PTSD had not gone away at all. She hadn't had a normal night's sleep since the attack. I told her of an amazingly simple, image-guided nerve block that might relax her hyperactive nervous system and help her relax. I started using this nerve block while serving in the military as a doctor treating soldiers coming back from Iraq and Afghanistan. She had a decision to make. Either just keep living with this mental trauma of reliving those events over and over again and not be able to enjoy the woods, and continue to suffer in crowded rooms or when hearing sudden noises. Well, she could self-medicate and continue to numb her mind, or she could work with me and try something new. That's when she decided to move forward with this new treatment. After I evaluated her, I could see she was a good candidate. This unique, powerful nerve block is called a stellate ganglion plexus block. She had never heard of stellate ganglion blocks, but was willing to try. Especially since it had a short recovery period, I did this nerve block procedure right here along her neck, and after 10 minutes, the procedure was done, and she could relax, and she went home with her partner and had the best sleep in years. Good sleep is so healing. And here's the best part. After her second block, the benefits lasted longer and longer. Now she's able to resume her active lifestyle with intimacy and a comfort level unknown for years. Isn't that awesome? Now you may be wondering, is this a permanent fix? And if not, how long will a procedure like this last? Well, the honest answer is it will be different for everyone. But on average, most people will have substantial improvement for 6 months to several years. For example, in her case, her PTSD was over 90% better for a year. This allowed her therapy to work much better too. When life brought its natural stressors that just happened, she could cope so much better and occasionally ask for another nerve block to keep her in the new state of normal that she was now enjoying. So I've mentioned this term stellate ganglion block several times. What is a stellate nerve block? The main concept is to relax your body's sympathetic nervous system temporarily to restore balance. This is the same responsible nervous system that was responsible for flight or fight behaviors. What happens when we're wound up so tightly we feel we're in a constant state of hyper alertness and just can't relax, even when the danger is over? Or we just can't shake that very bad experience. In order to restore this balance, the stellate ganglion block may be for you. What about a friend or a loved one who has a long-standing PTSD? Would they be a good candidate for this treatment? Or would if they had been told your only option is long-term medications to blunt your emotions? Can this procedure treat these problems? Again, it depends, but I encourage you to consider a medical evaluation to see if this special nerve block may be a good option. Many times this procedure improves lives, reducing the emotional pain of PTSD, and new information points to it even helping to treat long COVID. I hope this video has helped you understanding that there are other options to help treat PTSD other than just medicating or using other emotion-numbing drugs. Often a special nerve block procedure can help relieve this kind of pain and far less side effects, pain, and downtime. Now, this special nerve block to treat PTSD and long COVID is not for everyone. To help you decide if this option may be right for you, call us for a consultation at Phoenix Integrative Medicine, 907-671-0794. That's 907-671-0794. Thanks for watching. I'm John, and just like the phoenix rises from the ashes, we want to help you rise up and live life to its fullest.